Apple cider vinegar, is it a myth or does it actually do something? Let's find out. Hello and welcome to another edition of the Ask Dr. Pickel Show, and today we're going to talk about apple cider vinegar. You know, I had a recent patient that before coming to us, she had gone to her primary care physician about some stomach issues that she had, and she noticed, when she ate certain foods, she would get heartburn and reflux, and then she basically told me, she went into the doctor and they had told her to take this antacid drug, is actually a PPI drug. And then she said to the doctor, a friend of hers had told her to use some apple cider vinegar for her stomach. And she said she did. And she told the doctor, she goes, when I take apple cider vinegar, my symptoms go away. It actually helps me and I don't get the reflux, the heartburn. And she was like, can I do this? Is this okay? And the doctor basically told her that is a bunch of baloney, rolled his eyes at her and told her that she's only going to get worse and that she has to be on these medications. It's really the only thing that she can do and probably just is going to have to live with it. So she was very frustrated with that. And, because she was like, I know I got relief. I know it made me feel better, as opposed to the long list of side effects of the medication that she was prescribed. So she was looking for some answers, and she wasn't just satisfied to live with her diagnosis of this reflux issue and that she was going to have to be on this medication the rest of her life. So she came in and was speaking with us, and we started talking more about apple cider vinegar. And I'm sure you've heard of apple cider vinegar being used for health issues. Another thing that this patient had noticed was that when she took it, especially towards bedtime, she didn't wake up with joint pain anymore. She was like, wow. She goes, this is doing all kinds of wonderful things for me and really helping my health. So let's find out a little more of why. Why was she doing well by taking apple cider vinegar? What is actually occurring here, or is this really just a bunch of baloney? So first of all, let's understand apple cider vinegar. Apple cider vinegar is acetic acid. They just take apples, take out the sugar from the apples, and then they make that into what's called a sugar alcohol. They ferment it, and then you get an acid, acetic acid, which is at a low pH. Now, first of all, think about your stomach. Your stomach itself makes hydrochloric acid. That's the acid that breaks down your food so you can digest your food. Now, the stomach acid has a pH. It's the measurement of acidity. The lower the pH, the more acidic something is. And the pH of the stomach is about a 1 to 2, which is pretty darn acidic. Now, apple cider vinegar usually runs about maybe a 2 at the lowest to up to about a 3.5. So, and usually you're getting about a 3, maybe a 3.5 in acidity with it. So they're fairly close. So what is going on though? Why do we need the apple cider vinegar? What would this patient, what would the problem be that would require that? Well, what's happening is when you eat food, that goes down to your stomach, and the stomach makes acid, this hydrochloric acid, our natural stomach acid that we need. And our stomach was built for that. Our esophagus is built for that. The rest of our organs are built for that. We need it. But if you have inflammation in your stomach, if you have an ulcer, if you have some other health condition that's causing you not to make enough of the good acid, the hydrochloric acid, well, now when you eat that sandwich is just now sitting in your stomach, and the inside of your body is about 100 degrees. So that food starts to ferment or rot. I know that sounds gross, but when it ferments, it makes bad acids, these organic acids, and those are the ones that don't have the correct pH. Those are the ones that give you heartburn and reflux. Now you're not digesting your food, so you're not going to absorb it very well, and then you get this whole diagnosis. And then what they do is they put you on these antacids or these PPI drugs. Now, these may decrease your symptoms, but what did they actually do? Well, they suppressed all the acid. So even if it's hydrochloric acid, even if it's the bad acids from fermenting foods, you're just suppressing all acid. That's why long-term, these can cause problems, because now you don't even digest a lot of proteins, fatty acids, minerals, and then you become deficient in many things. So that's why you're never supposed to take them long-term, like sometimes many people do, which is kind of scary. So getting back to apple cider vinegar. So this apple cider vinegar, what happens when you take it? Yeah, now you increase some of that stomach acid. So this is kind of a temporary too. It's not like you want to be on doses of apple cider vinegar every time you eat for the rest of your life. Now there are advantages to taking it regularly, but not just for the stomach and digestion issues. It's something you can use while you're trying to figure out why you aren't making enough stomach acid. Do you have an H. pylori infection that's affecting your stomach's ability to make acid? Do you have an ulcer? Do you have high stress and your cortisol is suppressing stomach acid production? Do you have gastritis being caused by some other issue? I think or thyroid issues. These can all, there's so many possibilities that could affect the stomach lining itself and prevent you from making good acid. That's what we've got to find out, is what's going on. But in the meantime, you can use the ACV, the apple cider vinegar, to at least help you to digest and absorb your foods better, so you don't become deficient or don't have, more problems. All right, so basically when you get this apple cider vinegar, it comes in a bottle, and the kind you want actually has what's called the mother in it. So when you look at the bottle, it'll have this thing floating in it that looks kind of weird. It's actually kind of a yeast. It's a beneficial yeast and a beneficial bacteria that are in there. If you shake it up, it kind of floats around. Don't let that worry you. That's a good thing that it has that mother in there. All right. And so not only do we need this acid to digest our foods, but by taking apple cider vinegar, or if your stomach normally makes a good amount of its own acid, what other effects does that have besides just digesting your food in your stomach? Well, also it takes that acid, or that pH change that the acid provides, to close the valve in your stomach. So if you get reflux where it goes up into your chest or your mouth, that's because that valve isn't closing. And one of the biggest causes of that is not enough good acid to change the pH in your stomach to close that valve. Now, another thing that this acid does is it stimulates your pancreas with the pH change, so you actually release digestive enzymes to help digest your food too in the small intestine. So if low stomach acid, issues with your stomach, you are not making digestive enzymes on your own. And then the other thing that it does is when you release this acid, it stimulates your gallbladder to contract, which releases bile. And then that helps you to digest and absorb fats and oils. So very, very, very important that you have enough good acid in your stomach to cause all of these processes. And actually, there's quite a few more things that it does too. But definitely, those are key things. But you need that acid, again, to break down and digest your foods. All right. So now, some people will say, hey, Dr. Pickel, I took some of that apple cider vinegar. It actually burnt my stomach, or it made me feel worse, or it gave me a little reflux. Well, our stomachs make hydrochloric acid, which is stronger than apple cider vinegar. So if your stomach is reacting to apple cider vinegar, if it's sensitive to it, that means you have a stomach problem that's pretty bad. Whether you have a full-blown ulcer or just some really bad gastritis to make you really sensitive to this acid. So that means we really got to hone in on the stomach. And what can you do? Well, a few things potentially. Mastic gum, deglycerized licorice, glutamine, slippery elm, aloe vera. These are some natural options to try to help get things calmed down in your stomach so you can start to use the ACV. And doses can vary with those, and do look at our other videos that relate to those. But definitely there are so many benefits to this over these medications and just continuing to take these medications. Also, the benefits of apple cider vinegar, it's a natural antioxidant, or provides some of them. So this really can have anti-aging effects, prevent your cells from dying as fast. Just so many great things there. Also, studies have shown that apple cider vinegar lowers cholesterol, helps with heart issues, also helps with polyphenols. Polyphenols are the micronutrients that come from fruits and veggies that you eat, so you actually digest and absorb them properly, which have tremendous benefits, of course, for your health. Now, also, the other benefit is apple cider vinegar. If you don't make enough stomach acid, well, first of all, stomach acid is your first line of defense. So if you eat something and it's maybe got some bacteria in it that didn't get cooked out, some parasites, something in there, you eat that, first line of defense is your acid. And as soon as those bad guys hit that acid, kabam, they're gone. That's one of your first line of defense. Now, if you have low stomach acid, yeah, these bad guys can get into your stomach and start to cause some bad problems there. Infectious agents is what they are, which is not good, and they can thrive if you don't have enough stomach acid. Now, the apple cider vinegar, again, can help prevent that, and it is antimicrobial. It helps to kill these bad guys. That's why people not only use it for this, but they even use vinegar for cleaning things, which is a fantastic cleaner and solvent. All right. Another thing too with apple cider vinegar is there's been a couple of good studies with it where one of them, they took some diabetic patients and they found out if they took 15 milliliters twice per day, it lowered their blood sugar. How does this work? Well, basically, you're helping your food to absorb and digest better. So you're absorbing things through your gut better. A lot of diabetic issues are caused by gut inflammation and not making enough acid. So then you mainly only absorb the sugars and carbs, which causes insulin surges and messes up your blood sugar. So by taking apple cider vinegar, you actually digest your food. You don't just absorb sugars and carbs, and you get more of a steady blood sugar supply, and you don't get the insulin surge. Weight loss, they took about 39 people, divided into two groups. They put them on a calorie restricted diet, but one group they gave apple cider vinegar, one group they did not. The group they gave apple cider vinegar lost 8.8 pounds average. The group that did not take apple cider vinegar only lost 5 pounds. So yeah, you're actually digesting and absorbing what you're eating properly. If you mainly digest sugars and carbs, you go into storage mode and you don't lose weight as easily. So again, apple cider vinegar has some great benefits. I think it's worth trying. I think it's a great thing to do if you have certain health issues, anywhere from digestive issues to joint pains to so many possibilities. Again, some people take it for specific reasons. Some people just take it for general health, but really no negatives there. All right. Well, hopefully everybody got some great information out of this. Watch this next video. I think you'll like it a lot, and God bless, and I'll see you next time.